This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Patrick Hu, Melanoma Chair at the UT MD Anderson Cancer Center, our melanoma expert. Hello again.
Thanks, Selma, for having me here again.
I read recently that the incidence of melanoma in children is rising, and I found that utterly shocking. Let's talk a little bit about the patient population in general, and to begin with, what is happening with children and melanoma?
We're not sure exactly the cause of this, but it's tanning beds may be a potential reason. It's one of the thoughts behind this. And so in the state of Texas, for example, we just passed some tanning legislation saying that people under the age of 18 cannot go to have UV tanning beds and cannot go to tanning facilities. And I think that's a good law, and hopefully that will get passed in many other states.
Is there any advice you want to share with parents who have young children, and beyond sunscreen, are there things parents need to understand to help protect their kids?
Absolutely. One is just to avoid getting sunburns. Not just the use of sunscreen. Some people use sunscreen and they go out in the sun all day, and that's kind of counterproductive. So I think between the hours of 10 and 3, for example, when the sun is at its peak, you really have to be careful out in the sun, especially in the southern states. Our general rule of thumb is if your shadow is shorter than you, then you should seek shelter or put on some protective clothing.
Any other information for patients in general, and would-be patients?
In general, if patients should be seen by dermatologists regularly, and if there's a changing lesion or a changing mole, they should have that checked out, because it's really that evolution of that lesion that we look for, and if it's changing, then it should be evaluated by an expert.
Thank you very, very much for spending time with us at this ASCO. Dr. Patrick Hu, Melanoma Chair at the UT MD Anderson Cancer Center in Houston, Texas. Thank you.
Thank you.